I'm Dr. Sarah Pless, a general dentist in Wilmington, North Carolina, and proud HealthyStart provider. HealthyStart is a series of appliances that can help rewrite the script for children's dental as well as overall health. Here at our office, we like to screen kids for more than cavities and cleanings, and a lot of times teeth issues that are showing up in children as little as 2, 3, 4 can indicate that we do have some signs with possible sleep disordered breathing that not a lot of parents know about, but we feel it's our obligation as healthcare providers to share with them. So we have a series of appliances that we put children into if they're showing these telltale signs that can help them just learn to nasal breathe and be as healthy as possible, and then eventually get to a series of appliances where we can help with the alignment of the teeth and possibly prevent a more traditional orthodontic journey. We can really help intervene and start treating some of these issues at a much earlier age that hopefully, they can rewrite their dental journey. They miss out on some of the experiences of what adults have had to go through for all these years that we would consider normal, but treatable with medicines and pills and night guards and things of that nature. And so we just want to intervene as soon as we can and hopefully help these kids just be the best versions of themselves. I came to HealthyStart first and foremost as a parent and learned a lot about how to help my child who was exhibiting signs of sleep disordered breathing that I didn't even know were red flags. And so we worked out how to get her to come on board and be a HealthyStart wearer. And then I was able to translate that into being a dentist and a healthcare provider to our other children. So we've learned how to talk to adults and help them understand the issues that we see on their teeth, which is, teeth wear and tear and misalignment and crowded and chipped and crooked teeth. So we discuss with them how orthodontics can help remedy some of those issues, but what are the root causes that bring those things about? And then as we're discussing that with parents and their understanding, or adults and their understanding, what their issues are, they can't help but wonder, well, is my child about to come up the same journey that I've been on? And so HealthyStart has been this just excellent addition that we can care for not only the parents in our practice, but then their small children that are also here, and we're seeing them for teeth cleanings. And it's just the perfect way to, again, just get best health for the whole family. So that's a great question. So your son is 6 now, and we are likely going to be doing this until he finishes dentally growing at 12 or 13 or so. But I don't want you to be alarmed. He's going to be here getting his teeth cleaned, every 6 months anyways. And so largely most of the checkups during the time, it's going to be aligned with the time he comes in for his teeth cleanings. So we were talking to your son a little bit about some of these things that we were seeing and trying to make sure he understands also, because these are going to be his teeth that he's living with forever and ever. And we sort of explain what this is about being able just to wear a retainer at nighttime. We practice breathing through our nose, just how that's the healthiest way to breathe. And so I feel really confident about being able to coach him through these first few nights and weeks to make sure that this would work for him. But obviously you are always welcome to call us, text us if you have any questions along the way. We're going to be checking in virtually occasionally too, just to make sure everything's going A-okay. And if there are some hiccups in the beginning, that is to be expected. This is a whole new process, but we've got a lot of tips and tricks for how to make it as seamless as possible. Great question. I just found out about HealthyStart myself 2 years ago, and I really listened to it with the ears of the parent first. And so my child, having been my very first HealthyStart patient, I've learned a lot about how this can really help, and I've seen it myself with my own 2 eyes. It's been around for 50 years, but it's a little different than some of the other big dental things that you might have seen on TV. It's a really family-owned company, and they've done a great job. I mean, it was this particular orthodontist's life's work to investigate these symptoms and how he could best intervene in a non-invasive way. And this turned into the whole system of HealthyStart. And they've treated tons and tons of kids, over 1 million kids now, over the last 50 years. So we've got lots of historical backing, scientific backing for how this can help your child too. I am concerned that if we don't act, that these issues will not improve upon themselves. And a lot of times the way we used to look at kids was, well, this was just crowded teeth. And we would wait until they hit that 12, 13 mark and send them off to the orthodontist. And a lot of times orthodontics was great to put the teeth into a really beautiful smile and alignment. But if these airway issues don't get addressed at an earlier age, like what we're talking about now, he can still be plagued by quite a few dental issues, like having teeth grinding and TMD, and cracked teeth and chipped teeth down the line. So while orthodontics helps us with a lot of aesthetic things in the traditional sense, we really want to treat him as a whole patient and make sure we're talking about whole health with your son.
I'm Sarah. I have 2 daughters. One is 6 and the other one is 3.5. My dentist recommended it, Dr. Pless. She actually had a daughter similar age to my oldest who had just started HealthyStart and thought it might help with some issues we were having. We actually have 2 different conditions. The oldest one, she was a big snorer. She was snoring all night. Just not sleeping well. She would wake up in the middle of the night, of course come wake me up, and have to put her back to bed, and it was tiring to say the least. And then the younger one, 3.5, she actually has some bite issues where she's wearing down her front teeth, so we need to work on the alignment of those. The 6-year-old has improved greatly. She doesn't snore anymore at night. She wears her mouthpiece all night long. She stays in bed, which is amazing, and she was also having some issues with bedwetting early on, and that's improved as well. Surprisingly enough, she hopped into it pretty quickly. We worked toward all night, but immediately she started wearing it some and a little more here and there every night until we got to all night wear. And then of course little sister wants to be like big sister, so she's pretty much taken to wearing it all night immediately. They are little kids, so we had to work on that, and just really lots of stickers and rewards, prizes for milestones that we hit, and really just being consistent and reminding her that she had to keep it in all night. And even at night, if I would go check on her and it had fallen out, just waking her up enough just to put it back in. It is definitely worth the try. I was a little skeptical at first because she was also a thumb sucker, the older one, so I was hesitant because there's no way she's going to get rid of the thumb, but she did really quickly. So if she could overcome that, I think it's worth a shot for any parents who are having issues with sleeping and snoring and things like that. For the older one, she's sleeping all night. I mean, that's huge. You can't get better than that. She's not tired, she's not a grump most days, and she's able to concentrate a little bit better with having a good night's rest. We'll go back to the sleep. That's been the biggest part, is just getting a good night's rest and not having her wake me up, and just not having to worry about her and the snoring and why she's snoring. And with the little one too, I know that we've taken the best steps we can to fixing her teeth now when she's only 3.5 to get the alignment a little better so she's not wearing down those front teeth and having bigger issues down the road.